research in stroke right now about a therapy called thrombectomy. And that's a replacement for drug therapies. Before about 2015, people were treating strokes with clot-busting drugs.
Mhm.
And in 2015, there were these 5 major RCTs that proved that you could actually use a minimally invasive device. You snake it through someone's femoral artery all the way up to their brain and you pull a clot out. It's a really cool process. It's an endovascular technique. But people have mostly been using that for strokes in the front half of your brain, the anterior strokes. And now there's a ton of interesting research questions, and even several publications recently in the New England Journal about basilar artery strokes, which are the worst kind of stroke. And I'll actually jump in and show this from my slide deck again. But basilar artery strokes are strokes effectively of your brainstem, which means that they result in extremely high morbidity and mortality. Let me share this and I'll show you my basilar artery example. Sorry, we got to click through. Methods, though you can steal these from the course now. We're showing them. After your search, you're going to be filtering records, you're going to be extracting data. But for basilar artery strokes, they are a type of clot that is in the basilar artery in your posterior circulation, coming up your neck right into your brainstem. And they are the most neurologically harmful type of stroke. Even with treatment, mortality can be as high as 45%, and serious neurological deficit for most of the remaining patients. And this is actually a published review. And actually, let me show. This is your basilar artery right there. It comes, your vertebral arteries come together, form your basilar artery, and that feeds your brainstem. I was working with some Stanford physicians, and actually we have a case study published on our website where you can find their work on this review and their thoughts on our search strategy and our technology. But when we were looking at this, we said, okay, we have our P, right? If we take our P for basilar artery, it's going to be patients with a stroke of their basilar artery. And so we can basically start building our search strategy directly from that. We want acute ischemic strokes of the basilar artery. Mm-hmm. It's as simple as effectively reflecting your PICOs in a Boolean query. And by Boolean, I simply mean you're using parentheses, quotation marks, and ors and nots.
And ors and nots.
Yep, to structure the concepts. And so for basilar artery, quite simple. We say there's a stroke and it's in the basilar artery, one of the simpler Ps that we can try to search for. And then for our starter therapy, for our starter query, I can note that the therapy that we care about is thrombectomy. Now that may have synonyms, and I think a big part of your search strategy is going to be finding different synonyms for your terms of interest, but you can always start with just one that you know. And then of course, this is compared to clot-busting drugs or thrombolysis.
Yeah.
And then for outcomes, I can map out outcomes that I might care about. We noted on the previous slide that people like to track mortality and neurological outcome, so we can search.